Metastatic breast cancer is one of the most feared diagnoses, but there are some advances to help women with metastatic breast cancer. We have St. Luke's Cancer Institute Medical Director, Dr. Tim Pleward, who is here with us. Thank you so much for coming.
Thank you for having me.
So let's talk about metastatic breast cancer. What is it?
Metastatic breast cancer, also called stage 4 breast cancer, is when breast cancer has spread to other parts of the body. And that's when it becomes a life-threatening illness. Generally speaking, it's very treatable, but at this point, we don't really have a cure for it.
But there are some advances, and there's some really great strides that are being made in research. So you guys have this whole new center for metastatic breast cancer patients. What's happening there? What are we learning? What are we gaining?
So the Kuntz Center for Advanced Breast Cancer opened at St. Luke's 2 years ago, and it's focused exclusively on caring for women with stage 4 disease. And it's a very comprehensive approach because we know that these women are living longer with stage 4 disease because of newer treatments, but we're also trying to understand how they can live better, how we maintain the quality of their life, as well as hopefully prolong their life. So it's an integrated team. And in addition to physicians, we have research nurses, exercise physiologists, nutritionists, psychologists, all to try and take care of the whole woman or man who may have metastatic breast cancer. And we focus heavily on research in trying to test new therapies and identify new potential targets for therapy. But we're also looking at the impact that some of these ancillary services or integrative therapies have on the quality of life for women.
And this really excites you because this is one of the only ones in the nation, very few, that are really having this integrated approach, and we're seeing some good results. What are you seeing?
Well, what we're seeing is that women and their families and caregivers are not only doing better with treatments, but they're having better quality of life. And we're addressing the concerns that go along with this ongoing diagnosis of stage 4 breast cancer.
So what can we say to women who've had breast cancer? Because, you know, recurrence is a big concern. What are some things that we can do to try to prevent recurrence, to try to prevent the spread of cancer in our bodies?
Well, certainly early detection is key. I mean, the earlier you detect the breast cancer, the better the treatment outcomes and the lower the chance for recurrence. For those women who have been diagnosed with breast cancer, we know that in addition to the treatments, that lifestyle factors can help reduce the risk of recurrence. Exercise, maintaining your weight, avoiding alcohol, and there's actually some nutritional changes that can help, like fasting overnight for at least 12 hours has been shown in one study to actually lower the risk of recurrence.
All right, so make sure when you go to bed that you've got a 12-hour span there before you... All right, sounds good. I do want to say thank you. You are my medical oncologist. He does treat me there at St. Luke's, and thank you for taking good care of me. I'm still in remission, still wearing my breast cancer awareness pin all month, and thanks for all that you're doing for the women with metastatic breast cancer.
Well, thank you for having me.